Hi, I want to show you our new chat widget. This is something that we started using not too long ago, and the day that I put it on, it was about 11 o'clock on a Sunday night, and by noon on Monday, we had somebody who had a whole conversation with the chatbot and then joined the practice. It is working very well and very quickly, so let's go through and try it. This patient, when we ended up calling her to schedule, our assistant said that she knew so much about the practice. It made it very easy for her because she didn't have to answer a bunch of questions. All the questions had been taken care of in the chatbot. So let's ask. I've been testing this bot, so there's a bunch of questions in here already. Let's see. Do you take my insurance? This is the question you always get. And here we go. The chatbot's going to answer, and you can tell it exactly how you want this kind of question answered. So this is pretty much how we answer this question. You don't need insurance. What about hospital care? Another common question. And if there are certain questions that are specific to your type of practice that you get a lot, you can train the chatbot to answer these questions specifically the way that you would answer them. And here's not included. Then go through your insurance. Do I need insurance if I'm a patient? Which pretty much said we do that you if you're a patient, but let's see what the answer is. So it's a good thing that I'm continuing to test because I would correct it to say that we do, of course, encourage people to have insurance even though they have direct primary care. And let's see, I just want to show you how it's going to ask for information. It actually, because I've used this particular bot before, I've been testing this chat widget, it might not ask for the information because I've already used it, but let me see if I can get it to take some new information. So the last one, I used my dog's name, Katie. We always ask the bot to clarify that we charge a monthly membership fee just because people sometimes still slip by and get into the meet and greet and they are shocked that they're going to pay an additional fee above their insurance. Let's see. This isn't Katie. Let's just pretend. And so it's going to take information. Let's go with, this is our dog, Apollo Mars. Our CRM is going to have all these great names. Email, phone number. Sure, keep the same ones. So, because I had used this before, it's got the numbers and stuff in there. So, I'll show you what happens after this. So now, let's go to my email. You can see this was a automation that sent the email. And because even though I'd used the name Apollo Mars, because I used the same email and phone number, I think it just kind of got those confused. So here's the email, and it says, welcome, we're going to contact you to schedule your meet and greet. And also, we put in the phone number in here so that they know to look for it because so many people just don't answer their phone anymore. And that's how it works. Let me know if you want to book a demo call because this is something that is super easy to get installed on your website, and you can start, getting questions answered and getting emails and getting new leads easily with really no involvement with you. You can be doing this while you're seeing patients, if you're still working out your fee-for-service job, or if you're just starting out and you're busy and you're with patients. It's nice to have this because it is answering all those questions that you are going to get many, many times, and that takes it off you. And then when they do end up talking to you, just like our assistant said, these potential patients are already well versed in what DPC is, and they understand how your practice works, which saves you a ton of time. So contact me to get set up for a demo. Thanks.